The first time the alien students saw Walter jab a needle into his own arm, the lecture hall erupted in a cacophony of gelatinous gurgles, exoskeletal clatters, and one very audible gasp from a translucent being named Lef, who promptly dropped its datapad and recoiled into the nearest corner. Walter Jasper, a 34-year-old former paramedic now working as a cultural liaison aboard the interstellar academic vessel Gerfin's orbit, calmly removed the needle, pressed a cotton swab to his vein, and looked around at the sea of horrified alien faces. "Well," he said, flexing the arm slightly, "that's how vaccines work. You have harmed your circulatory conduit with metallic tubing," Lur, the group's assigned facilitator, said in a voice that crackled like frozen leaves. "Why?" Walter looked at the row of students, some of whom had retracted parts of their sensory stalks, others blinking in slow, nervous pulses. "It's not harm," Walter said. "It's medicine. Preventative medicine. The needle delivers a small dose of a weakened or inactive virus so the immune system learns how to fight it." Left twitched. "You willingly introduce disease into your body?" "In a way," Walter said, "but it's controlled. Safer than getting the full-blown virus later." A tall, plum-colored creature named Ren raised two of his upper limbs. "And you do this regularly?" Walter nodded. "Yearly flu shots, childhood immunizations, travel vaccines, you name it. It's normal." "Madness," muttered a green, rock-skinned student named Valo. "If a pathogen entered my physiology, I would dissolve my outer shell immediately." Walter grinned. "That's the difference. You dissolve. We train." Lur made a note on its tablet, then gestured to the students. This demonstration was not on the schedule. "Mr. Jasper, please avoid unscheduled needle insertions." Walter shrugged. "Would have warned you if I thought it'd cause a panic. Thought everyone had reviewed the human anatomy orientation packet." "We did," Lef said, still eyeing the used syringe on the table like it might leap up and attack. "But it said injections performed with sterile instruments, not self-stabbing during class." Walter chuckled and gathered the small tray. "I'll dispose of this. No contamination risk." As he exited the room, a low murmur followed him. Words like infection, madness, and voluntary wound were tossed around in varying dialects. He sighed. It wasn't the first time human medical practices had stirred a reaction, but he hadn't expected such visceral horror. Down in the medical bay, he handed the tray to Dr. Elira Morse, the vessel's chief medical officer and the only other human aboard. "Let me guess," she said, not looking up from her console. "You did the thing with the needle?" "Thought it'd be educational," Walter said. "Instead, I think I broke Lef's sense of reality." Elira finally looked up, frowning. "You didn't explain first? Didn't get the chance?" The vial was temperature sensitive. "Had to act fast." She sighed. "Next time, let me brief them first. Alien students need warning before watching someone pierce their own skin." Walter nodded. "Noted." The next day, the curriculum shifted to a comparative study in disease resistance. Lur, ever the diligent instructor, insisted on revisiting the prior day's demonstration. "You will explain again," he said to Walter. "This time with more warning." Walter stood at the front, this time sans syringe. "All right, team. Let's talk about the human immune system. And yes, yesterday's little syringe moment was a vaccine. It trains our body to fight disease." Valo raised a rocky hand. "You place your survival on training. What if it fails?" "Sometimes it does," Walter said. "Nothing's perfect, but it improves our odds." Lef's gelatinous form pulsed. "What if you inject the wrong substance?" "Then it's a problem," Walter admitted. "That's why we test, research, and regulate everything. No one's sticking random stuff in their veins." "Except you did," Lef pointed out. Walter blinked. "That wasn't random. That was the regulated flu vaccine." Lur turned to the group. "It is a cultural norm among humans to accept mild risk for greater protection. This is a key distinction. But it still involves puncturing one's own circulatory system," Ren said. "That seems primitive." Walter bristled. "It's calculated. Trust me, we didn't evolve with syringes in our caves. It took centuries to get here." Lur nodded. "Perhaps a field trip to the human medical lab on board will aid understanding." It was meant to be a controlled visit. Instead, it turned into something else entirely. The students filed into the medical bay, peering around at shelves of instruments, charts, and sample vials. Elira stood by a display screen, highlighting the evolution of medical tools. And here, she said, is the hypodermic needle, developed in the mid-19th century. Lev hovered near a tray of sealed syringes. This is what Mr. Jasper used? Walter nodded. That's the one. Suddenly, a sharp clang echoed across the room. Valo had stepped backward into a tray stand, knocking it over. A sealed ampoule shattered on the floor. Don't move, Elira said, immediately stepping forward with gloved hands. That was a mild muscle relaxant, but we don't know how it might affect non-human physiology. Lur raised one limb. Do we evacuate? No, Walter said. It's contained. But Valo had already begun to tremble. His rock-like exterior shifted color. Symptoms? Elira asked. My limbs feel light. Elira grabbed a scanner. Sit down. Valo's legs buckled. Walter caught him just in time. He's losing muscle control, Elira said. We need to isolate the agent. Walter helped maneuver Valo onto a medbed. It must have gotten through his dermal layer. Unlikely, Elira said. But possible if he had microfissures. Lur turned to Walter. What would a human do in this case? Flush the area, stabilize the patient, and run blood panels. You do not panic, Lur said. We do, Walter said. Just differently. Hours later, after Valo stabilized and was moved to observation, Lou approached Walter again. You responded calmly. Efficiently. I've seen worse, Walter said. Once had to give myself an adrenaline shot after a snakebite. You harmed yourself again? Saved my life, he said. Sometimes pain's the price of survival. Lur turned back toward the students. This is what you must understand, class. Human resilience is not just in biology. It is in choice. In willingness to act even when it appears irrational. Lev was quiet for a long time. Then he floated forward. Mr. Jasper, he said, when you injected yourself. Were you afraid? Walter paused. A little. Always am. But it's not about being fearless. It's about doing what's necessary. Lev pulsed thoughtfully. Perhaps. Fear is not weakness. Walter smiled. Exactly. The lesson didn't end there. 3 days later, while assisting with a cross-species pathogen simulation, Walter nicked his hand on a contaminated tool. It was minor, but protocol required decontamination and observation. You're bleeding, Elira said, holding up a scanner. Walter looked down. Yeah, caught it on the edge. Don't move. She cleaned and sealed the cut, then ran a toxin screen. Pinged yellow. Trace exposure to xelic proteins, she said. That's not good. Walter felt a wave of nausea. I thought we sterilized those tools. We did. Must have been residue in the airlock chamber. She handed him a sealed injector. Antidote. In the arm. Now. Walter hesitated, then jabbed it in. Outside the med bay window, Lev and Ren watched, wide-eyed. He did it again, Ren whispered. Just like before. But this time, Lev said. He looked afraid. Walter leaned back against the wall, breathing heavily. Burns a little. Elira scanned his vitals. Heart rate's high but stable. You'll be fine. When Walter finally emerged, pale but upright, the students gathered around him. You risked yourself again, Lev said. Didn't have much choice, Walter replied. The antidote window was short. Still, Lev said. You didn't hesitate long. Walter looked at them. When it comes to survival, hesitation can be deadly. Ren tapped his stylus against his side. We studied your physiology, your immune system, your medicine. But we missed something. What's that? Walter asked. Your absurd tolerance for pain. Walter laughed, then winced. Trust me, we don't like pain. We just know it's part of the deal. Lur stepped forward. Class, your final report will not be on human biology alone. It will include reflections on human behavior under medical stress. Walter raised an eyebrow. That a compliment? It is an observation, Lur replied. And as the students dispersed, talking in hushed tones about needles, vaccines, and the strange resilience of humans, Walter sat quietly on the nearest bench, flexing his sore arm. Next time, he muttered to himself, I'm making a PowerPoint. The lab smelled faintly of iodine and ozone, a combination that made Ren's secondary nostrils quiver. He stood stiffly at the edge of the surgical demonstration zone, his upper limbs folded in a way that suggested both suspicion and morbid curiosity. Behind him, the rest of the cohort hovered in a loose semicircle, careful not to crowd the sterile field. Walter adjusted the overhead lamp with a practiced flick, illuminating a synthetic model of a human leg complete with artificial muscle fibers and simulated circulatory tissue. A tray of tools lay beside it, neatly arranged: scalpel, forceps, clamps, sutures, and a small handheld cauterizer. He wore gloves this time. Lur had insisted. "No needles today," Walter said, sensing the tension. "We're practicing suturing. Stitching wounds." "Deliberate laceration followed by thread insertion," Ren said. "You've designed a ritual of self-repair." "Not self-repair. This is for treating others. Unless you're unlucky enough to be alone in the woods with a gash and a sewing kit." Left floated closer, translucent core pulsing softly. "You have performed this on yourself?" "Twice," Walter said. "Once on my forearm, once on my thigh. Bad camping decisions both times." "Your culture permits that?" Vaughn, a flat-bodied student with bioluminescent eye spots, shifted on his ventral fins. "Self-administered surgery? Permits it," Walter said. "It's not ideal, but if the alternative is bleeding out, we manage." He picked up the scalpel and made a shallow incision through the model's synthetic skin. Several of the students flinched. "This is the part where we stop more damage from happening," he said, switching to the forceps. "You clean the wound, align the tissue, and then you weave it closed, left finished. Like tailoring." "Exactly. Only instead of a jacket, it's your dermis." Walter demonstrated a simple interrupted suture, his hands moving steadily. The needle curved through synthetic flesh, thread drawing it together with each pass. "Why not just replace the damaged area?" Vaughn asked. "Biological patching seems inefficient." "Because we don't regenerate at the same rate you do," Walter said. "Human skin takes days to close naturally. With stitches, we speed up healing and reduce infection." Ren's eyes narrowed. "How do you tolerate the pain?" "We use anesthetics. Numb the area. And if you lack those?" Walter didn't look up. "Then we bite down on something and do it anyway." The silence that followed was broken only by the soft click of the needle driver. After the demonstration, Walter handed out suture kits. The students took them hesitantly. Vaughn poked the curved needle like it might bite. Ren tried threading his with 3 fingers and dropped it twice. Lef, surprisingly, managed a clean pass on his first attempt, though his thread looped unevenly. "Not bad," Walter said. "You're getting the hang of it." Lef examined the synthetic wound, his gelatinous body shifting in concentration. "Are human tissues this pliant?" "We're softer than most of you, yeah?" "No exoskeleton," Ren murmured. "No dermal plating. Just layers of meat and nerves." "Charming," Walter said, wiping down his tray. "But true." A low chime echoed from the corridor. Lur entered, holding a small silver canister. "There has been a procedural request from the diplomatic wing," he announced. "They ask for one of you to assist in a medical liaison role during tomorrow's treaty renewal." "You want a student?" Walter asked. "That's unusual. They require a medically oriented observer to stand by in case of physiological anomalies. Several of the diplomats are from thermally unstable species. You are the only human medical representative currently active." Walter nodded slowly. "All right, but I picked the student." "Approved." Lur left without further explanation. Walter turned to the group. "Who's not squeamish?" No one raised a limb, tendril, or appendage. "Didn't think so," he said. "Lef, you're up." Lef blinked once, the internal core dimming. "I have no practical field experience." "You're calm under pressure. You learn fast. And you didn't faint last time I bled." "I did not faint. I temporarily withdrew to recalibrate my expectations." Same thing. The next morning, Walter and Lef stood outside the treaty chamber, both dressed in sterile overcoats. Walter carried a compact medkit slung over his shoulder. Lef carried nothing, but his body glowed more brightly than usual, a sign of heightened alertness. Inside, the room buzzed with overlapping dialects. 2 factions, one aquatic, the other silicon-based, were negotiating territorial access to asteroid mining zones. The room was kept at a humid 87 degrees Fahrenheit for the comfort of the aquatic delegation, which made Walter sweat through his collar within minutes. Lef remained unaffected. I envy your lack of sweat glands, Walter muttered. It is not without drawbacks. I must regulate internal temperature via osmotic exchange. Sounds less messy. A siren chirped once from the far corner. One of the aquatic delegates, a tall, eel-like being with translucent ridges, lurched forward, then collapsed in a tangled coil. Left now. The two rushed forward. Walter knelt beside the delegate, checking for responsive movement. The eyes twitched, but the body convulsed. He's overheating, Walter said. Pulse is erratic. I detect rising ammonia levels, Left said. His gill membranes are contracting. Help me tilt him. Gently. Together, they rolled the delegate onto his side. Walter snapped open a cooling pack and pressed it against the ridgeline. His species uses external dorsal cooling, Left said. Lucky guess, Walter replied. I read the briefing. The convulsions slowed. The delegate's breathing shifted to a slower rhythm. Walter adjusted the cooling pack and checked the dorsal ridges again. He's stabilizing, he said. But he needs a rehydration compound. I can synthesize one, Left said. But it will take 3 minutes. Do it. I'll keep him cool. A member of the silicon-based delegation hovered nearby, crystalline limbs clinking. Is he dying? No, Walter said. He overheated due to the thermal lamp above his seating. It wasn't calibrated correctly. The crystalline delegate tilted its head. Humans perform medical interventions with no prior experience of species-specific anatomy? Walter didn't look up. We read. We guess. We adapt. By the time Left returned with the synthesized compound, Walter had already propped the delegate into a semi-reclined position. The fluid was administered via osmosis through the gill tissue. Within 2 minutes, the delegate's eyes opened. You saved me, he rasped, voice thick with internal pressure modulation. Just doing my job, Walter said. After the incident, the session resumed, though everyone kept a wary eye on the ceiling lamps. Walter and Left were escorted to a side chamber to debrief. Your actions were observed by 12 allied species, the diplomatic officer said. They expressed astonishment. I'd prefer gratitude, Walter said, wiping his forehead. You acted without hesitation, Left said quietly. Someone was in trouble. You don't wait for permission when someone's dying. Even if you might make a mistake, Walter leaned back. You're never going to have all the answers, but doing nothing guarantees the worst outcome. Left's core pulsed slowly. You are not fearless, yet you act. Walter stood, stretching his back. That's the job. Later that evening, Left returned to the lab alone. He examined the synthetic suture model under dimmed lights, the thread still embedded in the faux skin. He tried again, this time with steadier hands, passing the needle through with growing precision. He didn't flinch. Across the corridor, Walter watched through the glass for a moment, then walked away without a word. The lecture hall had been retrofitted overnight. Rows of adjustable bio chairs now lined the walls, and a central operating bench gleamed under a new set of sterilizable lights. The air was cooler than usual, just enough to keep microbial growth at bay without offending species with moisture-sensitive membranes. Walter stood near the center of the room in a fresh uniform, sleeves rolled up, latex gloves snapped on. A sealed transport crate hissed open beside him, releasing a faint smell of antiseptic and preserved tissue. Inside lay a synthetic arm, human in structure but grown from lab tissue for training. Its pale skin bore no marks, except for a faint blue vein winding up the forearm. Today, Walter announced, we're practicing emergency vascular access. That means getting fluids or medication into the bloodstream when time is tight and options are few. Vaughn's dorsal plates clinked softly as he shifted. Is this the same as injection? Nope. This is more intense. If someone's in shock and their veins collapse, you don't have the luxury of a clean little jab. You go deeper, faster, and sometimes through bone. Left, stationed beside a tray of instruments, tilted forward. Bone. Emergency intraosseous access, Walter said, holding up a short, thick needle. Into the marrow. Painful but effective. Valo's mineralized jaw stiffened. You force entry into internal skeletal cavities? When there's no other choice, Walter replied. And yes, it hurts. But if it's between that or dying from blood loss, it's not much of a debate. Ren leaned slightly toward the model. And the subject remains conscious? If they're lucky, we sedate them first. Walter placed the needle against the simulated tibia. I'll demonstrate. Try not to faint. He braced the leg with one hand and pressed with the other. The needle clicked through the synthetic skin, then gave a soft pop as it punctured the simulated bone. A small light on the side turned green, indicating correct placement. You feel for resistance. When it gives, you're in. Then you flush the line. He attached a syringe of saline and pushed. A slight bulge formed in the model's soft tissue, then flattened as the fluid dispersed properly. Line's good. Now you can deliver meds, fluids, whatever's needed. Leff moved closer. You retain all this knowledge without computational assistance? Paramedics don't get much time to consult manuals mid-crisis. Vaughn raised a limb. How do you know where to insert? Human anatomy varies. We train with landmarks. Tibial plateau, sternum, humeral head. You learn to feel through gloves and blood and adrenaline. Walter stepped back. Your turn. The students approached slowly. Valo hovered near the tray, eyeing the marrow needle with the same suspicion one might reserve for a live grenade. Ren reached first. His long fingers moved with precise calculation, but the tool slipped as he pressed, skimming the surface of the leg without puncturing. Too shallow, Walter said. Push harder. You'll feel it give. I do not wish to damage the structure. That's the point. You break in to save the rest. Ren pressed again, this time with more force. The needle clicked in. The green light blinked. Nice, Walter said. Flush it. Ren injected the saline with an almost reverent stillness. This is a brutal method. It works. Each student tried in turn. Some were tentative, others overly forceful. Leff's attempt was the most accurate, steady entry, smooth flush, no blowout. He looked down at the model, then at Walter. You've done this on real people? More than I can count. Were you always successful? No. I miss plenty. But when someone's crashing, you don't stop to mourn a botched attempt. You try again. Valo stood at the far end of the room, arms folded. He hadn't approached the model. You're up, Walter called. Valo didn't move. You've dissected more biological systems than anyone here. This is not dissection, Valo said. This is intrusion with intent to preserve. I have no context for that. Walter crossed the room and picked up the needle. You ever seen someone bleed out? I've seen expired forms. Never the process. It's not silent, Walter said. They gasp. They twitch. Their skin changes color. If you can stop that with one tool, you learn how to use it. Valo considered this, then stepped forward. He took the needle, lined it up, and drove it in with a single, clean motion. The light blinked green. He didn't say anything as he flushed the line. Walter nodded. That's the best one today. 2 hours later, the students had dispersed and Walter remained to sanitize the equipment. He moved methodically, wiping down surfaces, remounting tools in their trays, checking expiration dates on simulation fluids. Leff stayed behind, silent until the room was nearly empty. You teach us human techniques, Leff said, but we have no baseline for your urgency. That's because most of you don't deal with mortality like we do. But we do. Just differently. For us, medical intervention is calculated. Yours is chaotic, immediate, and deeply personal. Walter packed the last tray into its container. You want sterile procedure, go to a surgical suite. Emergency medicine's messy. You improvise, you multitask, and sometimes you scream into the void while trying to restart someone's heart. Leff pulsed faintly. You've done that. Only twice. One worked. One didn't. Neither spoke for a while. Then Leff said, We're studying your methods. But I think what they really want to understand is why you keep stepping in. Walter rested a hand on the sealed crate. Because if we don't, who will? Later that cycle, a message pinged across the internal vessel network. The aquatic delegate Walter had stabilized earlier had formally requested human representation on a rotating medical advisory panel. The reason cited was unorthodox yet highly effective field adaptation. Walter read the message over dinner halfway through a lukewarm protein slab. He didn't smile. He just pushed the tray aside, stood, and walked out of the mess hall without a word. The next morning, he entered the lecture space to find Lur waiting with a new assignment roster. The students have requested continued training in human emergency medicine. They believe it will enhance their multi-species intervention readiness. Walter raised an eyebrow. Voluntarily? They have begun practicing outside scheduled hours. Leff organized it. Walter glanced at the schedule. All right. Next session, we cover tension pneumothorax. Hope they're ready to stab chests. They believe they are. Walter turned to the room where the students were already assembling. No one flinched this time when he opened a tray of needles. He picked up a model torso, turned it toward them and said, "Let's put some holes where they count." And for the first time since he'd boarded Gerfin's orbit, no one looked away.